So it's a behavioral health practice. We initially started just focusing on high quality care, doing standard American Psychiatric Association guidelines. And over time, we found that patients weren't getting better as much as we wanted them to. So a typical response rate is like 30–40% when you use psych meds.
Hmm.
And over time, we got into integrative health and functional medicine, and we saw that when we started combining nutrition and endocrinology, that our response rates went up significantly. So things that the typical psychiatrist would not be thinking about when it comes to psychiatric care, we started to incorporate, and we were finding all these unaddressed issues clinically with patients, and we started combining that with the psych treatment. In terms of seeing progress, the first thing is engagement. Just the
Hmm.
fact that the patients are able to come in, and we make that easy using telemedicine, so you don't have to have a job where you need to take an hour to
Right.
go across town to
Yeah.
see a provider. So how quickly you're able to see your provider, the ability to follow up, so you know that you're able to go to those ongoing sessions to continue your treatment. And also, we take standard rating scales at the beginning and then see your evolution in terms of the improvements of those rating scales. So how bad were your symptoms when you first started your treatment, and then how much does that improve over time? And so by monitoring those factors, we're able to get some clear objective measures that things are getting better. And
Hmm.
even biologically, we track people. So when we find biological factors that are off, we can see, those initial rates. We can have an intervention where we're addressing those problems. The AI revolution has been a wonderful time when it comes to understanding data and leveraging data in useful ways. So data
Hmm.
is definitely at the heart of everything that we're doing, both in understanding, where the problems are, what are the things that we need to address and fix, the places for improvements in terms of what it points to what interventions you should implement, and also being
Hmm.
able to track that whatever you're doing is working. So we see wonderful opportunities both on the operational side to decrease cost of delivering care, and even more exciting for us is on the clinical side that there's so much genomic data and other biological markers and lab tests that we can incorporate in terms of how we do psychiatric work. And
Hmm.
so we really see that we're at a point in the discipline of psychiatry where we can really have this transformation of how we think about mental health conditions, and both in terms of defining them and treating them. And data is what's making all that possible. So definitely a really exciting time to be leveraging it.